Thank you so very much. A birthday boy is with us today. Braden Ball is here. Sherry is here. Welcome, family. Talk right up into your microphone. Hey, Braden.
Hiya.
Happy birthday.
Thanks.
You know what? How about we do this? How about you guys, we sing happy birthday to Braden. Are you guys in? Are you in? Okay, are you ready? John, Gary, Dave? Okay, here we go. Happy birthday to you. Happy birthday to you. Happy birthday, dear Braden. Happy birthday to you. Well, what do you think about that? Is that the first happy birthday song of the day?
Yes, it is.
Well, good. I'm glad that we were here to share it together. Braden, how you doing?
Really good.
You feel pretty good?
Oh, yeah.
Okay.
Excited.
All right. You're excited for your birthday today.
Mm-hmm.
Excited for a lot of things. What grade are you in now?
11.
Oh, my goodness.
Junior.
Okay. Prairie du Chien. What's the name of your school?
Prairie du Chien High School.
Okay.
Yeah.
So, what's on the menu tonight for your birthday meal?
Tacos and brownies and ice cream.
Okay. Sherry, Mom, are you doing the baking? Pass the mic over to your mom.
I already did the baking.
Oh, you did?
I was just going to make cookies because I made him some from school yesterday, but he told all his teachers that I wasn't baking him a cake, and they thought I was really mean. So, hey, I made brownies last night, too.
Yeah, I think we know who got 2 treats out of the deal.
Yeah,
So,
isn't that sneaky?
Yeah. Well, it's good to have you back. We've
Thank
been
you.
together for quite a few years. Sherry, while you have the mic, how does Braden's story begin?
He has an undiagnosed genetic disease, and that started out when he was born. His hips were dislocated, so that was the first thing. And then he had his first ear infection at 2 weeks, and then ever since after that, it's just different things all the time. He has low bone density, and he gets sleep apnea, and some orthodontist things, and just many, many issues with many different parts of his body. He's had some procedure done, I think, from his eyes all the way down to his toes. So, in 20-some surgeries. I don't even keep track, but a lot of things.
You know, Braden, I'm going to ask you a couple questions. We decided that maybe since you're 18, we would shoot for 18 calls during our time together. How do you feel about that?
Really good.
You feel good about that?
Yeah, I think we can make
784
it.
kids is a phone number. 784-5437. So that's what we're going to do. So I'll update you as time goes on, okay? So we're going to shoot for 18. I've heard some phone rings. I've heard some calls coming in. So I'll update you in a second. But let's see what we can do about that, okay? So what's a day like for you? What happens?
Well, I wake up at 6:40 to take a shower during school, and then eat, and then take the dog out and stuff, get ready, and then I go to school, have fun with my friends, and try and have as much fun as I can. I got really good scores on a few of my math tests and
Good job.
a push tests, and then I got the score for my ACT a few weeks ago, and I'm above average, so I'm like a professional in that. Yeah, scored a 52.
Well, congratulations on that. Mom, you've got to be pretty proud. Yes. Okay, so what happens when you have to go back in for a doctor appointment or stay over in the hospital? How do you feel about that?
I'm used to it now, but like I don't really know.
It's a tough thing to be used to, you know. So what happens when you go in? Do you know how long you're going to have to stay? I mean,
No, we usually it's only for like a few hours though. But if like something bad, like I get sick or injured or something, I'm probably gonna think I'm gonna stay there a few days to like rest and stuff.
are there sometimes that you're a little sad because there's some things you can't do?
Yeah, like sports and hang out with my friends and stuff
Okay.
a few times.
So what kind of sports would you like to play?
Probably I'm thinking like basketball or like few baseball ones.
Is it tough to watch games on TV? Do you or do you support your teams, or is it tough to watch when you know you really can't do some of those things?
Yeah, I try and like stay out of it so my mind doesn't like get all sad or whatever, and I can't do all this.
So, Sherry, what has Children's Miracle Network Hospitals done for your family and done for Braden specifically?
A lot. Let's see, Braden's 18, so she turned into an adult today, but
Yeah,
the last
you're still
7
trying to get
I know.
wrap your
I cried this
your head
morning.
around that. Did you cry this morning?
Yes.
Oh,
Let's see, this is our 7th or 8th year that we've known about CMN. So we've had,
Styrofoam mattress.
yeah, we had mattresses bought.
why did he need a special mattress?
Because he had bed sores, so he needed something else to put on the hospital bed, or even his regular bed, because he's so underweight. What else? Oh, we've had tests done that the insurance wouldn't pay for that they helped with. We've had gas cards, food vouchers. We had a recumbent bike to help with his core strengthening, because he has low muscle tone and low bone density. What else did we have? We had a 3-wheel trike bought. They helped buy a computer. Jesus, there's a lot.
It sounds like the
Quite a
list
lot.
goes on. And there's always different ways of helping out. Doesn't it amaze you that they can figure out what you need and how to help you? Isn't that just amazing?
It's nice, but I mean, if I am not sure if they would help with something, then I can just, call one of the girls and ask, and then fill out an application, and most of the time, if it's a medical need or something that he needs, then they'll help fund it.
It's really
find
nice.
a way.
It's really nice to know that support system is there.
It is. A lot of times, too, people think if they don't, they can't afford to give a whole lot to Children's Miracle Network. But, a food voucher, when you're sitting in the hospital, even if it isn't a $5 voucher for food, it's more knowing that someone else cares, that someone else is there, someone else is thinking of you. So for me and my other children to get a lunch while he's hospitalized, that $15 made a big difference, just to know somebody else cared.
Just to know somebody else cared.
Yes.
Let's see if we can get an update on our calls. It's 784-KIDS, 784-5437. Let's see if we can get an update. We're going to work on that. We're going to keep you on the edge of your chair. Okay? You on the edge of your chair? Okay. All right. So he's just getting to the edge of his chair, like I told him to. You're a good little listener. So listen, we want 18 calls because you're 18. Guess how many we have right now? 12.
12?
We have 12, so we have a little bit of work to do, but we're really getting there at 784-KIDS, 784-5437. We'd like to thank IC Systems. They're over there answering all those calls today. Thank you, group.
Thank you. We
Thank
met him
you.
we met him in the break room.
Did you meet him in the break room? While we were enjoying Baracho's lunch. Have you guys had your lunch back there yet?
Yeah.
We did.
We're the first ones.
You were the first ones? We
Yeah.
went right for it. Yeah. It was great to have that lunch donated from Baracho's today. Huge supporter of Children's Miracle Network Hospitals, and we thank them for that. And what we're going to do is we are going to see what we can do about increasing some of these calls coming in. For 784-KIDS, 784-5437 is the phone number to call. Is there any doctors or nurses that you can think of that you would like to say hello to today? You have some favorites?
Let's see. Yeah, I know it's a lot.
Your orthopedist,
Dr. Winterstein. She,
And then who else is on that list? I know there's quite a few.
I need to find it. Oh, Dr. Uko.
Okay.
Mary Ann Campbell.
All right.
My care coordinator, Heather Terry.
That's important to have.
Oh, yeah.
They have a big job. A care coordinator does, because
A lot
it's
of work.
Yeah, well, there's things that you need, and they're able to take care of. You're in a good health system, aren't you? Yeah. Your 18th birthday. What do you think you'll be doing in like 5 years? Do you have a game plan? What do you want to do?
I'm thinking of going to Southwest Tech after school for college, trying to get office job there, like sit behind the desk, maybe human resources or office or administrative manager or something, and then hopefully getting a good enough job to pay my bills. And
Well, that's a goal for all of us. You enjoy being with people. I think. What do you think about
yeah.
Mom? You cried when he's 18. What are you going to do when he goes off to college?
Well, I'm hoping he still stays home when he goes to school. Fenimore's not that far away.
Okay.
I don't know, I'll be sad.
Your mom would
I'll
like you to
probably cry
stay.
again.
Yeah, I know. Well, you're a great young man, and the phone calls are coming in. We'll get an update here in a second at 784-KIDS, 784-5437. We're going to have 18 calls. We are. I know we can do it. We were at 12, and we're waiting to get a little update because I've heard some phone ring. You've heard them too?
oh yeah.
Okay. So what people are doing is getting the generosity of their heart and putting it into a phone call at 784-KIDS, 784-5437. Gunderson Health System, we're here in the lobby. Can you imagine taking over a lobby like this? Look what we've done for 3 days. I think people should stop by and see us, don't you, and see what goes on here? Because sometimes it's a little hard to describe, but we're at 13 calls right now.
13.
We're at 13 at 784-KIDS, 784-5437, and we're getting there one by one. Wait a minute. There's a new update. We're at 15. 15 is the new number. Isn't that amazing?
Yeah.
Just like that. So we're shooting for 18 because we are celebrating your 18th birthday today. And what you decided to do on your birthday is come share it with us. You know, that makes us feel really good. Because the only way that we can tell your story is by having the two of you here doing that for us. Do you feel funny about talking about your
No, I'm
health
kind of
situation?
open, like, to express my feelings and how my life's been. I'm always kind of been social and open about that. But, like, some stories I kind of am because they're, like, more personal. Like,
It bothers you a little
yeah,
bit?
some do. But
Yeah. Guess what? 16. We're at 16
16?
calls at 784-KIDS and 784-5437. 2 to go. It's the Children's Miracle Network Hospital's Radiothon. We have Braden Ball with us today, who just happens to be an 18-year-old today. And Sherry, Mom, you are so supportive. Every time that, we get ready to do one of these events, there you guys are.
Well, thank you. Braden knew this is the first year out of the 7 or 8 that we've been here that it landed on Braden's birthday. So I said, you sure you want to go? It's your birthday? And he said, yeah, what I want for my birthday is what?
calls.
You want calls for your birthday?
He wanted 18 calls for his birthday.
You want 18
Yep.
calls? Well, you know what?
So we signed up.
Well, we appreciate that, and I think you're going to get your birthday wish. And you haven't even blown the candles out on your brownie yet. That's
Not
tonight. Yeah, you're going to have 18 candles on your brownie?
Yeah, hopefully.
All right. So see, I see your game plan. I'm on to you. So, that was great that Mom made you birthday cookies last night, but then, you throw that little thing out about not having a cake, and the next thing you know, she's making you a pan of brownies. So you worked it. You did good. Yeah, these 18 years, you've done real good. 784-KIDS and 784-5437. So what is your favorite... I'm going to ask you something favorite now.
Okay.
What is your favorite thing to do in your free time?
Oh, boy.
Do you have free time?
Oh, yeah.
Mom knows your answer. Let's see if you have the same answer that Mom does.
I think I know what she's thinking of, too. I'm going to say it's probably gaming.
And I think you're right, because Mom's shaking her head. Tell me about this gaming thing.
I like 7 till 10 p.m. I game with my brother.
Oh, is it like set? It's part of the day?
Yeah.
You have that?
I have
Okay.
scheduled day, usually. We usually get on at the same time and play games together. He lives in Manchester, so we try and play with each other a lot. We're like best brothers.
Nice.
We really do a lot for each other, and we both get sad when we aren't on.
Well, you miss them.
Oh, yeah.
So we're looking for 2 more calls. 2 calls at 784-KIDS and 784-5437 because we had a lofty goal this hour, and it's 18 because you're 18. We're looking for 2 more calls, and something tells me we're going to get it because I'm hearing a lot of chatter from the Blood Center of Wisconsin phone bank, and it's IC Systems that are manning the phones right now, and they're doing a great job. They're really concentrating. They're really concentrating right now, getting our phone calls answered at 784-KIDS and 784-5437. And people are calling, and I'm hearing your name being mentioned over there. So I think you probably have some friends or some family or maybe school calling in.
Yeah. Well, let's see. They knew that I was going to be on here. My friend Jan from the office. Thank you, Jan. I love you.
Aww.
I let her know, or my mom wrote a note that I was going to be on here for my birthday. So we celebrated the school like yesterday and stuff. And so she sent out email to all 3 of the school districts or the schools to let them know that I was going to be on here. And they put me on TV, on the TV there, so it shows up. And I've been asking a few teachers to try and donate as much as they can. So.
Well, that was your 17th call. We're 1 away.
1 away.
We are
We're
1
almost
away.
there.
And I think what we're going to do is we're going to dig in our heels and we're going to go for that 1 call. We're waiting 1 more because we're trying for 18 for your 18th birthday at 784-KIDS, 784-5437, waiting for the phone to ring for 1 more call this hour, and we'll make it happen, won't we?
Mm-hmm.
We're going to do this
Definitely.
all together because that's kind of what happens, isn't it? We're kind of all in it together.
That's right.
From your doctors and the we didn't even mention.
Takes a team.
Well, it does. And I mean, if you have to have someone to coordinate your care, that means there's a lot of things going on.
Yes.
There's a lot of
I'm
things
grateful
going on.
for the care coordinator, well, and his team here. He's had a lot of physicians leave and new ones come in, and we've had one of his favorites pass away a few years, Dr. Voles. We always remember him. And then, you know, you become like a family in all the years that you're here. The nurses, the CNAs, the CMAs, the lab techs. He's got a favorite lab tech that pokes him in Parade Sheen. Yep.
Do you ask for that lab tech specifically when you have to go in for your blood draws?
Yes, I do. We're really good friends, Chrissy Hall, and well, to be honest, she calls me her boyfriend. Well, she has a husband.
That works.
A little story. When I was sitting, Mom was out in the lobby, right? And I was going in for a fasting lab. I couldn't eat anything normally, and there were a few talkative, chatty people in there, and I was talking to them. And so she comes running by the window, and she's like, "Where's my boyfriend?" I was like, "I'm here," or whatever. And then we waited a few more minutes, and then she's like, "I'm ready." And then one of the persons in the lobby came up and she's like, "I think she's waiting for you." I was like, "Yeah."
Perfect. That's a relationship that happens when, unfortunately, you have to go in a lot, don't you? Did we get
made
18?
it. Yeah, we made it.
We got 18. We have a lot of generous people in the Cooley region, and there's a lot of people that are backing you up, buddy.
Thank you to all of them.
And I think that's right. We just hand out a great big thank you to everybody who called. We're going to let you guys go. You need to go home and enjoy the rest of your birthday. Thank you for spending it with us. You came here for a really good reason, and we appreciate it. And you're feeling good?
Oh, yeah. I haven't had surgery at all this year, not since the ear surgery. So I've gone a year so far without a surgery, so I'm pretty happy.
That deserves a great big yay.
Yeah.
Braden and Sherry, thank you. Thanks
You're
for
welcome.
coming in to visit.
Thank you, everybody, for donating your time here.
You're listening to the Children's Miracle Network Radiothon, a service of the La Crosse Media Group.